Hello everyone, welcome to Core Chiropractic's Weekly Wellness Tip. My name is Dr. Dean Jacks, and today we're going to be talking about supplements, but really answering the question of the four most important ones that I do recommend. And this is pretty a broad general swath, but the four most common ones that people should take. So stay tuned for the Weekly Wellness Tip. So common questions that I get, almost not every patient, but a lot of patients ask me, should I take up supplements? What should I take? How should I take them? When should I take them? And so forth. So it can be pretty complex. But when you look at it, there's four main ones, general ones that most everyone should take. So I can't say this is for everyone listening to this, but it does apply to most of us. And what we need, first of all, is a daily multivitamin. So multivitamin, including minerals as well. This is going to be part of that, what I call the four horsemen, so the four main ones that most everyone should be taking. So multivitamin is number one. Number two is going to be some type of fish oil. So this is a Pro Omega from Nordic Naturals. When you are getting your fish oils, making sure that it is a high quality one, that it's pure, no toxins in them, so we don't want to take a supplement that we think is helping us and actually can be hurting us. So fish oils is going to be number two of the four. Number three is going to be a probiotics. A lot of different types of probiotics out there, but taking a probiotic, this is so important for gut health and our immune system. Gut health also affects brain function as well, so many good benefits from taking a probiotic. And probiotic, there's so many different cultures and strains that usually rotating ones out about every 2 to 3 months, or maybe about once a quarter is a good idea as well. So changing the cultures and strains of probiotics that you are taking. Number four is vitamin D. Most people in the United States are deficient in vitamin D. Vitamin D, we think of bone health and bone density, which it does play a big role in that. But probably the biggest role that vitamin D has is our immune system function. So enhancing immune system is huge by taking vitamin D. And vitamin D, we should take it year round for most people, but especially during the winter months. Even here in Florida, between what I call Halloween and around Easter time, you should supplement with more vitamin D. And if you don't know your vitamin D levels, it's a simple blood test. Just ask your family doctor or get a blood test drawn to see what your vitamin D levels are to make sure you know how much you should supplement. So those are the four horsemen, what we call the four most common ones that most people need. There are some other specialties that other people may be deficient in that they need to take more of, or something like CoQ10. So this is CoQ-NOL. What somebody needs to take this for is if they do take statin drugs. Statin drugs will inhibit the liver's ability to produce coenzyme Q10, so it's important for them to take it. So this is an example of more of a specialty type of thing where people may need to focus on other areas away from these four here. So this is a general rule. Again, it doesn't apply to everybody, but it gives you some guidance on really what you should be spending your money on. And really not taking too much. A lot of people, when I'm checking supplements, they bring in a shoebox or a box bigger than that of just things that they're taking, and they're spending hundreds of dollars a month on supplements, and a lot of them are just they're repeats. They're taking multiple things of the same types, and you don't necessarily need to do that. So having it focused down with a couple specialty branches in there is usually going to cover most people. So hopefully this was helpful. Get the most bang for your buck, get a good quality supplement as well, and we'll talk about that in a future health tip as far as how to choose different brands. So thanks for tuning in, and have a blessed day.